is going to be some numbing, just to numb the area. Burns a little bit going in. Good. That's it. You did great. Same thing on the other side. Good. So, slightly elongated earlobe, but difficult to wear heavy earrings. The tissue is very thin. And so we can bulk up the tissue in the earlobe to give it some more strength so that larger earrings will sit right and that the area won't look as aged compared to the rest of her face, which looks more youthful. We're just going to add some volume to the earlobe. You have to use a fuller bodied product to do this successfully because we're not trying to necessarily erase wrinkles, just add more volume and firmness to an otherwise fragile earlobe so that when earrings are worn, they can sit well on the earlobe. You can instantly see a noticeable difference. And when we go to the other side, you also see the wrinkling effect, the weakness of the earlobe. And those tissues atrophy over time, so we look to where we can distribute the product most effectively and efficiently. And that's usually circumferentially around the ear piercing. And Voluma is a very long-lasting product, especially in this area. It's not an area that moves a lot, so it doesn't really get chewed up as fast as a product might in other areas of the face. As you can see, it's a very comfortable procedure. It's very easy to numb the earlobe. It's not a very sensitive area. And patients feel really good about this procedure. It adds a lot of confidence, especially when you want to wear pretty earrings and people are looking at your ears. It's a nice, quick way to improve the area. There are other surgical procedures that can happen to shorten, strengthen, add more bulk, change the shape of the earlobe, but that's a more involved procedure. This one just takes minutes. And what patients tell me is they really like how their earrings sit better on their ears, and they can wear heavier, different shapes of earrings that they otherwise couldn't. That's great. alcohol wipe. Okay. And that's a really wonderful correction with half a syringe on each side. Over the course of a few days, the swelling will go down, the area will stiffen up even further. You have good facial correction. And this is all numbing with epinephrine, so it decreases the risk of bruising, and that white blanching appearance will go away in about an hour.
Sorry.